Good morning to our media partners and good morning of course to our resource person who you will meet later, no? Bago 'yan, ngayong buwan na 'to, ating sine-celebrate ang Nutrition Month, no? So today, we are moving towards a healthier Pilipinas. I would like to cue in yung opening message ni Cabsec Nograles for in celebration of our Nutrition Month.
Secretary of Health Dr. Francisco Duque III, Undersecretary Dr. Maria Rosario Singh Vergere, National Nutrition Council Executive Director Dr. Azucena Apet Dayangirang, fellow public servants, guests from non-government organizations and development partners, friends from the media, mga kababayan, maayong adlaw kanatong tanan. I'm honored to be with you all at today's #Media Solution, Kapihan with Media. Now more than ever, we should utilize all platforms available to further strengthen our campaign towards ending hunger and malnutrition in all its forms. As part of this year's Nutrition Month celebration with the theme, Malnutrition Patuloy na Labanan First 1,000 Days Tutukan. This year's theme underscores the need to be even more cognizant of health and nutrition because we cannot deny that the existence of the COVID-19 virus has amplified the growing need to address this problem of hunger. We know that the problem of malnutrition has been a global health problem even before this virus existed. Unfortunately, the pandemic has eroded the progress that we've already made in improving nutrition and ending hunger. Medical journals report that malnutrition could even exacerbate the effects of COVID-19 in mothers and children, and at the same time, more children are becoming malnourished due to the deteriorating quality of their diets, interruptions in nutrition and other essential services, and the socio-economic shocks resulting from the ongoing pandemic. This is the very reason that despite the challenges brought by COVID-19, we continue to host events like these to raise awareness on important issues like hunger. While we are grateful that we are being joined by people from all walks of life, we have actually strategically identified the specific target groups who can support nutrition improvement. First, pregnant women. Through this campaign, and together with the other existing mechanisms that we have, we are aiming to reduce the prevalence of nutritionally at-risk pregnant women. Attuned to this year's theme, the Duterte administration gives special attention to the first 1,000 days of life. First, signing of Republic Act 11148, an act scaling up the national and local health and nutrition programs through a strengthened integrated strategy for maternal, neonatal, child health and nutrition in the first 1,000 days of life, also known as the Kalusugan at Nutrisyon ng Magnanay Act. Second, the inclusion of the National Dietary Supplementation Program for pregnant women and children under Key Result Area Number 3 of our National Food Policy. And finally, the pilot implementation of the Tutok Kainan Supplementation Program by the National Nutrition Council. Our second target are, of course, families. As a basic unit of society, this is where education on proper nutrition really starts. Subsequently, the majority of children aged 6 to 23 months old lack proper nutrition, resulting in poor nutrition early in life. It is thus imperative that we instill the values and right information on nutritional management within the homes of families. Children learn their behavior in different aspects based on what they do and see in their own homes. There is a heightened need to provide support to families so in that way, children can learn the proper behavior and outlook towards nutrition. Third target are our local chief executives. Local government units, through the support of our local chief executives, as the grassroots implementers of our program towards nutrition, have a crucial role to play in our advocacy. While we are grateful for the will and dedication of our chief implementers, there is a growing need for us to invest more in nutrition by acquiring and training more local nutrition officers and staff so we may ensure proper and efficient implementation of our programs on the ground. And as chair of the Task Force on Zero Hunger and advisor of the Scaling Up Nutrition in the Philippines, we've ensured that there are programs focused on the first 1,000 days of life. LCEs may further expand these programs for the benefit of your constituents. I'm continuously asking for your support so that we would be able to continue and attain or even exceed our targets, attaining zero hunger in all areas. Finally, the group of NGOs, civil society, academia, NGAs, LGUs. The battle towards hunger and malnutrition is the battle of all. Private sector, civil society, and non-government organizations, development partners, and the academe have been very supportive of government programs even before. But their participation now is very much highlighted and appreciated. In fact, they are also leading, complementing, and vigorously supporting the efforts of government in addressing hunger and malnutrition. This is evidenced by the Scaling Up Nutrition Network as well as the Pilipinas Kontra Gutom. It is my hope that all of us would be able to converge and synergize even more. Imagine the impact of our work if we all pool our efforts and resources towards one common goal. Possibilities are endless. Investing in nutrition, especially in the first 1,000 days of life, is an investment for the people and our future. Naway, sa pamamagitan ng ating kampanyang ito, tayo matuto ng mga tamang impormasyon at mahikayat ang lahat na tumugon sa pagbibigay ng akmang nutrisyon at pagsupil ng kagutuman. Kailangan nating magtulungan. Ngayong Nutrition Month, sama-sama nating ipromote ang abakada para malnutrition ay labanan first 1,000 days tutukan. A. Alagaan ang buntis. Ba. Breastfeeding kay baby. Ka. Complementary feeding na sapat. At da. Dapat lahat suportado ang pipan. Malnutrition, patuloy na labanan. First 1,000 days, tutukan for a hashtag Healthy Pilipinas. Muli, maraming salamat po sa inyong lahat at patuloy tayo na mag-ingat.
That has been Cabinet Secretary Carlo Nograles, who chairs the IATF on Zero Hunger. That was truly an inspiring message from him. Now, to give us a deep dive of the first 1,000 days efforts of the government, we have, of course, with us the Executive Director of the NNC, the National Nutrition Council, Dr. Azucena M. Dayangirang. Dr. Azucena Dayangirang is an experienced public health leader. For the past 29 years, she has been a facilitator and a trainer for various health programs, particularly on maternal child health and nutrition. She has served the people of Davao as City Nutrition Action Officer from 1991 to 1995. She is also the Chief of the Technical Services Division and Medical Officer 6 of Davao City Health Office from 1996 to 2005, as well as the Provincial Health Officer and the Provincial National Nutrition Action Officer of the Davao del Sur from 2008 to 2016. During her stint in the local government, she led the City Nutrition Committee in the planning, implementation, monitoring, and evaluation of health and nutrition programs. She initiated the Fresh Milk Supplement Feeding Program, which led to the reduction of protein, energy, malnutrition among 0 to 6-year-old children. She also successfully lobbied for the regularization of 32 nutritionist dietitians deployed in the 16 districts of Davao City in 1996. In 2016, she was elected as the National President of the Nutrition Action Officers of the Philippines Association, Incorporated. Shortly after, she was appointed as Deputy Executive Director of the National Nutrition Council, an attached agency of the Department of Health. In 2000 of August, Dr. Dayangirang was appointed as Executive Director of the NNC. Currently, she is designated as the Scaling Up Nutrition Philippine Government Focal Point Person, and most recently appointed as the member of the Executive Committee of the Global Scaling Up Nutrition Movement representing Asia and Papua New Guinea. Here to give us a deep dive of the first 1,000 days efforts of the Philippines, I give you Executive Director Dayangirang. Ma'am, the floor is yours.
Yeah, thank you very much. Isang malusog at masustansyang araw sa ating lahat. A pleasant morning to Cabinet Secretary and Chair of the Interagency Task Force on Zero Hunger and Scaling Up Nutrition Advisor of the Philippines, Cabinet Secretary Carlo Alexi Nograles. Good morning also to the Chair of the NNC Governing Board and Secretary of Health, our very own Dr. Francisco T. Duque III, DOH OIC Undersecretary Maria Rosario Berhere, media partners, program managers, and communications personnel of DOH Centers for Health Development. Let me greet everyone on Meaningful Nutrition Month. This year's theme is Malnutrition Patuloy na Labanan, First 1,000 Days, Tutukan. Actually, the theme reaffirms the call for continued multi-sectoral efforts to address malnutrition using the Philippine Plan of Action for Nutrition, or PPAN, as the national framework for action. The theme emphasizes the need to scale up interventions in the first 1,000 days through the strengthened implementation of Republic Act No. 11148, or otherwise known as Kalusugan at Nutrisyon na Magnanay Act, especially in the context of the COVID-19 pandemic. This Nutrition Month, our goal is to educate, encourage, and engage all Filipinos. Educate because there is still limited awareness on the Philippine Plan of Action for Nutrition, or PPAN, and the first 1,000 days as evidenced by surveys. While people are more aware now of nutrition, well, the challenge is practicing the positive nutrition behaviors to prevent malnutrition. This is why we want to encourage Filipino families to participate in nutrition interventions. And third, because of the complexity and scale of malnutrition in the country, we need to engage all stakeholders to participate in efforts to end all forms of malnutrition. The campaign wants to reach specific target groups whose behavior or actions can support nutrition improvement. Now, for pregnant women, to have normal weight gain and to reduce them from being nutritionally at risk and having low birth weight babies. We also target families, especially those with 0 to 23 months old children, to ensure proper nutrition, that is exclusive breastfeeding and appropriate complementary feeding, and to be madiskarte in doing so. We also target local chief executives, our governors, mayors, and barangay captains to support nutrition because those who have done so have been able to reduce malnutrition in their respective areas. And lastly, we call on everybody, the civil society, NGOs, business, academia, media, and government to work together to be able to scale up the much-needed nutrition interventions for impact and synergy. Now, for better recall, the ABACA messages have been identified to support the campaign. The ABACA messages focus on key actions in the first 1,000 days of life, while the DA calls on all stakeholders for support in order to implement and fulfill this year's theme, Malnutrition, Patuloy na Labanan, First 1,000 Days, Tutukan. Now, prior to the COVID-19 pandemic, we are seeing improvements in nutrition situation. We have actually reduced micronutrient deficiencies to below the level of public health significance, affecting less of our population. We have also seen reductions in the prevalence of nutritionally at-risk pregnant women, as well as steady declines in the underweight and wasting in children. These are because of the interventions that we all have put together or put in place under the Philippine Plan of Action for Nutrition. However, because of lower prioritization and investments in equities and capacities of families, we still face significant challenges in reducing child stunting, adult obesity, hunger, and food insecurity. And because of the COVID-19 pandemic, we expect malnutrition to get worse. We are seeing more families going hungry and having limited access to food. Surveys showed that there were interruptions in the delivery of nutrition and related services, reduced health-seeking behaviors as families are afraid to go to health facilities. Even physical activity is reduced, which can impact on overweight and obesity. But we are not discouraged. We have the Philippine Plan of Action for Nutrition, or PPAN 2017 to 2022, as our framework for nutrition actions that provides evidence-based interventions even during a pandemic. Now, and the key really is to focus on the first 1,000 days of life, or from conception up to the child's second birthday, to 270 days for the total pregnancy, and 2 years, 365 per year times 2, that's total 1,000 days. Evidence shows that the most strategic period to prevent malnutrition and achieve children's potential for physical growth and mental development is during this period. Our challenge is to be able to scale or to increase these interventions in the first 1,000 days so we can make a dent in child stunting in particular, our biggest and most important challenge. We can actually reduce stunting by at least 20% if we increase the coverage to at least 90% of these 6 critical interventions in the critical first 1,000 days. And what are these 6 critical interventions? First, during the 270 days of the whole pregnancy cycle, there must be at least 4 prenatal visits in 3 trimesters. Second, the taking of iron folic acid supplementation for 180 days by pregnant women. Third, balanced protein energy dietary supplementation for 90 days in the 3rd trimester. And the recent evidence by the 2021 Lancet series reiterates the same interventions with the inclusion of evidence supporting multiple micronutrient supplementation to pregnant women. Now, during infancy, there should be exclusive breastfeeding for the first 6 months for optimal development and immunity against illnesses and diseases. We must also ensure the strict implementation of the milk code, such as not allowing milk donations. We must also provide support and counseling to mothers. In older stage of infancy and toddlerhood, children need to receive age-appropriate complementary food, in addition to breastfeeding, and are provided with micronutrient supplements such as vitamin A and micronutrient powders. Now, recent evidence by the 2021 Lancet series reiterates the same interventions as well as new ones, such as provision of multiple micronutrient supplementation to pregnant women, supplementary feeding in food insecure areas, and lipid-based nutrient supplementation for children 6 to 23 months old. Obesity or overweight should also be prevented in the early years through integrated interventions including diet, exercise, and behavior modification. The PPAN, or the Philippine Plan of Action for Nutrition, continues to espouse nutrition-sensitive interventions that impact on the determinants of malnutrition, such as investing in water, and hygiene and sanitation, promotion, malaria prevention, and preconception care. Evidence points to the need to reach also the most vulnerable group, which includes those living in geographically isolated and disadvantaged areas, or the GIDAs, and those who belong to the indigenous peoples. But all of these interventions need political will and resources. The Interagency Task Force on Zero Hunger is one way to synchronize efforts to address hunger, food insecurity, and malnutrition. Government resources are also complemented with the private sector through the Pilipinas Contribute movement. And we recognize the efforts of Cabinet Secretary Nograles and Scaling Up Nutrition Advisor of the Philippines for getting these initiatives moving. Early on, we recognized that more heads are better than one. Thus, the Philippines joined the global Scaling Up Nutrition movement since 2014. And since then, we have been able to organize 4 networks or alliances under the Scaling Up Nutrition Philippines. These include the Civil Society Alliance, the Donors and Development Partners Network, the Business Network, and lastly, the Academic Network. They complement government as well as the United Nations member organizations. Now, we hope to expand the network from the national level down to the subnational level as we also collaborate with the 62 other member countries of the SUN movement. Now, we encourage other stakeholders to join the Scaling Up Nutrition Philippines movement. Now, along with our fight against malnutrition is our battle against fake news and misinformation. The role of media is critical, especially during the Nutrition Month campaign, to create a greater awareness of the importance of nutrition and promote positive nutrition behaviors to our stakeholders. These are evidence-based interventions proven to contribute reducing malnutrition and are included in our Philippine Plan of Action for Nutrition, or PPAN 2017 to 2022. We call on the media to ensure that accurate information on proper nutrition is shared to the public. And before I close, let me share suggested activities by which our audience in your community or organization can do during Nutrition Month. One is help disseminate information about Nutrition Month in whatever channel available to you. If you can hold nutrition webinars, but make sure that correct information is shared. If you belong to an organization, see how we can support nutrition activities on a more longer term beyond Nutrition Month. You can also do volunteer work in communities and within your family to ensure all members are properly nourished, which can include having home food gardens, regular physical activity, and the like. And lastly, participate in Nutrition Month activities in your community, making sure, of course, to follow the minimum health standards. The National Nutrition Council has lined up several activities for Nutrition Month, and these will be reviewed, and these will be in our FB pages and other our websites of the NNC. While we are in a health emergency because of the pandemic, we cannot forget that Philippines is one of the countries with the most disasters and emergency. Thus, it is a challenge to be an emergency during a health emergency. Also, July happens to be a National Disaster Consciousness Month. And we know just how much disasters and emergencies impact on nutrition. That is why it is important that we plan for both normal and disaster contexts. The latest advisory by the Philippine Institute of Volcanology, or PHIVOLCS, reported that the Al volcano is at an alert level 3 with high level of activity. Now affected areas are now being evacuated. In times of emergency, nutrition should remain a priority. And the following actions support nutrition during times of disasters and emergency. First, activation of the nutrition clusters led by the National Nutrition Council and DOH through the Nutrition Action Officers. Second, prioritization of nutritionally vulnerable groups, including pregnant and lactating women and infants 0 to 23 months old, or the first 1,000 days. Third, provision of ready-to-use supplementary and therapeutic food and micronutrient supplementations, such as vitamin A. And fourth, ensuring that there are mother-baby friendly spaces. If there is none, coordinate with a camp coordinator. And fifth, ensuring that milk donations are prohibited. In closing, may I ask everyone to join me in reading our call to action for nutrition. And let us read this. Let us all work together to eliminate all forms of malnutrition. Raise a new, lucky 1,000 generation of Filipinos achieving their full potential. Now, be one of the spoons to advocate for good nutrition among Filipinos beginning in the first 1,000 days of life. Malnutrition, patuloy na labanan, first 1,000 days, tutukan. Thank you all so much, and we hope that we have triggered your excitement to participate in this year's Nutrition Month campaign. And for more information, please contact us. Again, a meaningful Nutrition Month to all. Dahil sa PPAN, panalo ang bayan. Daghang salamat kaninyong tanan ug maayong buntag sa tanan. May God bless us all.
Maraming salamat po sa inyo, Executive Director Dayangirang. Bago ko po buksan ang floor for questions from our media partners, I'd just like to say, no, napaka-importante talagang magbigay tutok sa first 1,000 days ng isang bata, no? As Secretary Nograles has mentioned, investment po ito. Pangalawa, makikita natin that this is truly a whole of nation, whole of society approach to ensure na walang maiiwang bata, no? At pangatlo, even amid the pandemic, we continue to provide the necessary programs, no, para po sa ating lahat, particular na po sa mga bata. With that, I open the floor for questions, beginning with Red Mendoza from the Manila Times. Go ahead, Red.
Hi po, good morning po, Doc. Good morning po, Doc Apet. Doc, first question. Of course, we all know the pandemic has severely affected the celebrations and the commemorations of Nutrition Month. So, how are we adjusting towards this pandemic as opposed to the last time we had more activities such as in 2019? So, how are we able to adjust po, Doc?
Actually, thank you very much for that question. No, so as I've said before, no, we have lined up activities dito sa ating Nutrition Month, and because of the COVID-19 pandemic, marami tayong gustong syempre, yung minimum public health standard, but enjoy pa rin. So, last July 1, of course, meron tayong webinar launching on the Nutrition Month. That is the kick-off event. And in July 8, meron tayong tinatawag na Home Online Nutrition Exchange or HONE. And in July 12, meron tayong tinatawag na Food Systems. We will be conducting a webinar, puro tayo webinar, Food Systems Summit Independent Dialogue with different scaling up nutrition networks, and this will be participated by LGUs, no, partner natin sa mga NGAs and also mga NGOs. And also we have Nutrition Month Conference via webinar platform and NNC Facebook. Ito yung mga question and answer na gusto nilang malaman about Nutrition Month, not only about Nutrition Month but healthy diet, all about nutrition, no, particularly in this COVID-19 pandemic. So, Nutrition Month culminating activities, we do have also in MNC Facebook. And on July 30, meron tayong i-conduct na National Nutrition Summit among local chief executives. This will be all over the Philippines, but a webinar, we are expecting our governors, our provincial planning, our municipal mayors, city mayors, who will be joining us in a question and answer format. Meron tayong panelists, and we have invited Cabinet Secretary Nograles, DPM Secretary, so that if they will ask question about the Mandanas-Garcia ruling, so all these things, and the DILG Secretary. So webinar lang tayo. And in the LGUs naman, inaasahan natin ng mga local government units will also be conducting their very own Nutrition Month celebration. So nandoon pa rin yung IATF guidelines natin. So minimum public health standards. So lahat yun dapat ating i-observe. So
okay. Sandali lang po, ma'am. Sense po, sorry po. Second question po, Doc. Of course, my last question na rin po. Right now po, of course, Nutrition Month has been parang very much being put into obscurity minsan or overlooked by media right now or the general public kasi parang it's always been like what? Para siyang school-based activity lang siya lagi, parang ganun. So, Doc, can you give us yung parang pinaka basic way or pinaka-importance ng pag-celebrate ng Nutrition Month, not only just for dun sa first 1,000 days ng mga bata, but also yung to the general public. Kasi we all know nga na the pandemic has shaken things up. I mean, almost everyone didn't have the time to notice what they're eating right now or what they are kung ano yung mga kino-consume nila right now. So ano po yung parang pinaka-importance po ng Nutrition Month na hindi siya ma-relegate into something like a parang very much trivial na event na lagi na lang sinaselebrate minsan sa school. I mean, we all know that Nutrition Month, like parang hanggang school-based activity yan, pero the public doesn't even know much about Nutrition Month. So, how can we hope to expand this into a much more insightful celebration or commemoration po, Doc?
Wow, thank you very much for that question and concern. Really, really, I appreciate it. Actually, July is just commemorate yung celebrated as the Nutrition Month. Since 1974, this issuance by President Ferdinand E. Marcos to celebrate July as the whole month, Nutrition Month, July 1 to 31. But definitely, basically, we eat every day, no? So nutrition should be every day. So we must put in mind, especially to the families, no, to mga caregivers natin, that nutrition, what we put on the table, what we serve to our children and to our families, really affect the whole being of a person, no, sa families natin. So if we value good nutrition, the balanced diet, the nutrient dense diet, then we value our family. So in fact, in this COVID-19 pandemic, we see to it that nutrition should be at the core, because without nutrition, without ready nutritious foods available on the table per family, our sickness will all be affected. No, more and more, kumbaga, our immunity will be affected. So this is the reason why that we really, really advocate every day to be Nutrition Day. No, kasi kung walang pagkain, people will get hungry, and then all the more if COVID-19 will be here in the midst, no, of everybody, then more so, wala kang immunity to fight against this infection. So really, thank you very much. And for the media friends out there, really, we would like to help engage everybody here, not only the media, but dito sa DOH, mga communications media unit natin. So please, nutrition should be on the core of everything that we do. This must be every day, because we eat at least 3 times a day, no? So dapat nutrition. Right? Thank you.
Thank you po. Thank you po, Doc Ape. Thank you, Laura.
Thank you, Red. Next question will be coming from Sheila Crisostomo. Sheila, go ahead and ask your question.
Hello. Hi, ma'am. Ma'am, itanong ko lang, ano po yung impact ng pandemic sa Filipino children in terms dun sa kanilang yung health condition? Like, may data po ba kayo? Tumaas ba yung malnourished, undernourished because of the pandemic?
Actually, ang tinatawag natin, in 2019, we have what we call the Expanded National Nutrition Survey. That was in 2019. Bumaba na sana tayo on stunting, meron na tayong 28.8%. From 32% yan siya in 2018. No? So, meaning to say, bumaba na sana, gumanda na. Nung dumating ang pandemic, naku Diyos ko, tumaas ulit tayo to a level na naging 30% na rin siya, from 28 to 30%. So bumalik tayo dun sa 30% level. So 3 out of 10 children are stunted. So walang kinundak na survey ang DOST FNRI in 2020 amidst the pandemic, COVID-19 pandemic. But dahil ang National Nutrition Council is nag-advocate to the FNRI to do a rapid nutrition assessment survey, RNAS, no? And this was conducted in December of 2020, no? At nakita doon, out of the target beneficiaries for the sample survey, nakita doon na tumaas talaga. Number 1, ang hunger prevalence. Siyempre, kung hungry ang mga tao, so it will result to malnutrition. More so, wala malnourished na nga, wala pang kinain. So it will really lead to malnutrition. And based on the rapid nutrition assessment survey, mothers' perception ng 31.9% of mothers na target beneficiaries doon sa survey na yun stated that their children, all the more, bumaba ang timbang, meaning naging underweight more. And then, yung stunting natin, of course, chronic malnutrition siya, more so, tumaas din. So ito yung impact talaga. Then wala nang access to food. Of course, wala kang kinain, so because wala kang access to food. Nandun yung lockdown eh. Walang market, no? Close ang mga market, and then tayo, yung mga families were advised to stay at home, and then kung wala silang home garden, so walang food. That is the reason why National Nutrition Council issued an advisory, 2 advisories in April and in March. One in March, nagkaroon kami ng advisory na to advise all local government units to if they give food rations to their communities, kailangan meron siyang nutritious foods in it, no? So nandun yung fish, fresh vegetables, nandun yung fresh ang tawag nito, chicken, eggs, so yung ganun. Unlike ng iba, no, before, yung mga disasters na, at least, nandiyan yung mga dilata, mga noodles, but in spite of, nandiyan pa rin yung mga dilata noodles, we advocated sa advisory namin, dagdagan naman nila ng gulay, dagdagan naman nila ng fish, dagdagan naman nila ng mga eggs, para naman ihaluin yon, maging nutritious na. Yun. And the second advisory is yung ina-engage namin at ina-encourage namin lahat sama-sama within the community. Lahat ng NGOs, present kayo dyan. If you want to have transportation sa mga food rations dito, yan, na-advocate namin. And lahat ng business company, if they really care for their employees, bigyan nila ng food rations din within the company sila. And they did it. And then LGUs were very receptive. And in fact, I myself, when I did my monitoring, in fact, ako nakatanggap din ako ng ayuda sa mga local, sa barangay namin, no? Nakatanggap din ako ng fresh produce ng vegetables, fish, and gulay for 1 week straight yun. So, ibig sabihin, they were receptive to the advisories of the National Nutrition Cluster with DOH. So, yun. Tumaas talaga, ma'am. But we are not complacent. Ang sabi ko nga, NNC, together with the Interagency Task Force on Zero Hunger, and of course, our Mother Unit, Department of Health, hindi po kami nagpabaya. We continuously conducted mga counseling and advisories, issued advisories, and also advocated to the local government units. And ang NNC, I'd like to announce that NNC started with the Tutok Kainan, TK ang tawag namin yun, together with the Interagency Task Force on Zero Hunger, Office of Cabinet Secretary Nograles, itong tinatawag natin Tutok Kainan on the first 1,000 days. Kasi ang sabi natin, ang most vulnerable during the COVID-19 pandemic affected are pregnant women and children 2 years and below. So, tinutukan ng NNC ito, binigyan natin ng supplementary feeding ngayong first month, Nutriban, and then ang LGUs, meron silang counterpart on milk and on water, no? And then on the second month, nag-wet feeding tayo. So the program or the feeding program runs for 90 days. And then we will be starting our complementary feeding program for children 6 to 23 months old. Kasi yung 0 hanggang 5 months and 29 days, dapat exclusive breastfeeding. So mag-start tayo ng complementary feeding on the 6th month. So starting na yan by last week of July, so we'll be kicking off the activity for the complementary feeding, and that will run for about 6 months. In selected LGUs, why selected LGUs? Kasi sila po yung napakarami na nagpalista or nakalista sa master list na tumaas po yung malnutrition nila. So, thank you.
May data po kayo on malnutrition, and do you also expect na mag-increase ang obesity because yung mga bata online classes so walang masyadong activities?
Actually, meron po kaming data, Sheila, no? So, just give us your email address, Sheila, so that my Nutrition Surveillance Division will be able to give you the exact or the accurate data that we have in our database.
Pero ma'am, yung sa obesity, do you also expect to see?
Yes. Yeah, definitely. Triple burden ang problema ng bansa natin, no? With the COVID-19 pandemic. One is increase in stunting. So stunting yung pagkabansot, no? That is low in height per his or her age. No, this is not only the physical pagkabansot, but more so the brain development is affected, no? So second is because we have the triple burden, yung micronutrient deficiencies disorder, yung hidden hunger natin. Tumaas din yung vitamin I, iron deficiency anemias, yung mga vitamin A deficiency disorder and iodine deficiency disorder. And third, yung sinasabi natin na obesity. So, merong undernutrition at may overnutrition din. Tama ka, Sheila, tumaas dahil nga walang klase, puro na lang text, puro na lang, ang tawag dito, iPad, no? Sa mga mobile devices, wala nang physical activity. So, tataas. So, this is the reason why that we are advocating here during Nutrition Month. Kung pwede, kung walang klase, TikTok challenge, dance challenge, and how you will celebrate Nutrition Month in your communities.
Ma'am, last na po, Corbin. Ma'am, how about, ma'am, yung sa breastfeeding, tumaas ba since work from home ang mga mothers? And yung pong na-mention yung mga percentage ng children, anong baseline number nito? Ilang children bali sila? Yung unang na-mention yung po mga data on stunting.
Ay, opo, meron tayong data on stunting also, no? Let's go back to your question on exclusive breastfeeding, no? So tumaas actually. Hindi naman sa napaganda, but we can always analyze things na dahil ang mama is naka-lockdown, meaning naka-lockdown ang buong Pilipinas that time when we started the pandemic, no? So, syempre, nandun siya sa bahay, and she has all the time to take care of her infant or yung sanggol niya. So, exclusive breastfeeding tumaas. So, that's good. That's one good thing na nakita natin during the pandemic. However, ang tinatawag mo na stunting is because nga of the scarcity of food, wala silang access. Meron talagang data natin, especially on ARNAS, tumaas doon sa tinatawag natin na especially in the rural areas, dahil wala na silang access to food, tumaas po yung stunting prevalence natin. And then yung dito sa rural, sa urban, na-analyze nga ng Rapid Nutrition Assessment Survey na sila pa yung hindi masyadong nakaramdam ng gutom dahil grabe yung suporta ng mga city LGUs natin, especially here in the NCR. Dahil grabe yung focus ng ating mga mayors dito. They really give everyday ayuda to the families. So, but yung mga hard to reach areas talagang walang access. So, yun sila yung tumaas yung stunting prevalence. But I've said, if you want an exact or accurate data, please give us your email ad, and right there and there, we will send you the data so that you can have a good picture of everything.
Thank you po, ma'am.
Thank you, Sheila. Thank you, ma'am. Next question will be coming from Carolyn. Carolyn, go ahead and ask your question.
Ma'am, nabanggit niyo po kanina na sa rural areas yung mga nakakaranas ng yung mga stunted children. Ma'am, may info po ba anong age po ito?
And when you say stunted children, ito yung mga under 5. Under 5. So, studies will tell us na ang pinakamataas na nag-start ang stunting, is between 6 months to 1 year old. So, this is the reason why na ito yung tinututukan namin ngayon, yung first 1,000 days. Kasi pag tutukan mo itong first 1,000 days, studies will tell us na ito yung golden window of opportunity from pregnancy up to 2 years ng bata. So pag ito ay lahat ng government efforts, lahat ng ating mga convergent programs natin, like even the 4 Ps, kung may mga anak sila na less than 2 years old, talagang ina-advise namin during the family development sessions that they should give their infants, especially under 2 years old, yung, of course, continue breastfeeding and yung nutritious foods available. Gulay. We have mga ready-to-use food, ready-to-eat. So, lahat yon ina-advocate ng National Nutrition Council. We have flyers actually. We have flyers actually. We can send flyers to you because in certain age group, meron yan siyang mga flyers. Even the adolescents, pregnant women, yung mga food na dapat kainin ng mga buntis. Alright? So, kinakailangan natin yan i-advocate sa kanila.
Ma'am, last na lang po. I'm just curious. Ma'am, meron ba tayo sa Pilipinas na parang deaths because of malnutrition? And if meron, gaano ka dami po yung latest na na-record? Thank you po.
Actually, based on records ng hospital, kasi madalas sa pedia ward yan siya, sa pediatrics ward. No? Uh, ngayon, ang latest data ngayon, we cannot yet tell you, kasi wala pang latest na dumating sa atin, Ella. No? So, but to tell you honestly, because the reason why na namamatay sila is because of one, talagang dehydration, no? Dahil severely malnourished na sila in the hospitals. At kung hindi man maagapan sa hospitals, yung mga nasa malalayong lugar na, dahil wala silang access to health services and nutrition services, namamatay din. But rarely, ngayon, tinatawag natin yan sila na rare lang, only in hospitals na may data tayo. But in the communities, wala. Kasi ang sabi lang, madalas magsabi lang na namatay secondary to may sakit siya, pero walang direct cause na. Payat siya ma'am, kaya lang namatay siya dahil may pneumonia. So yun. So complications, died complications. But when you see the nutritional status, diyan natin malalaman na that if a child dies, and then yung nutritional status niya per age niya is talagang malnourished, then ang death certificate niya is, example, 3rd-degree malnutrition, then cause of death, pneumonia, yung mga ganun. So, frankly, we have to get the records from hospital about that one. So, if you want data, we can also share with you as soon as we get it from our FSIS with that field.
Thank you po.
Thank you.
Thank you, Carolyn. I think that's all the question we have for today. No, so ma'am, I'll ask you for your final message. Maybe give us your reminders. How can we provide nutritious food on the table, po, ma'am?
All right. Thank you very much. And with this, I would like to thank everyone. But just a reminder, wala pong not all nutritious foods are expensive. In fact, we can get it. No? Ang tinatawag natin na pinggang Pinoy. So we have pinggang Pinoy. So the very fresh, the fresh as possible na food na kakainin natin, like gulay, fruits, and also we have protein rich like eggs and fish, and then green leafy vegetables, we have yellow vegetables, lahat po ng uri ng gulay, kakainin yan. And then, we all know for a fact that dito sa NCR, ang kulang lang talaga sa atin dito is the time to cook, no? Cook our meals. So, therefore, we will be advocating to our fast food chains kung pwede mag-reformulate sila and to offer nutritious meals, no? For the whole community or for the whole population. So yun lang. NNC, meron po kaming official website, nnc.gov.ph, and we have our FB page also, and we have our Twitter, and we have our first 1,000 days PH. So all the resources you want to know, we have there. So very accessible po. National Nutrition Council official. And we have our question and answer if you want to ask questions so that our staff can answer your questions. So please do log in to our first 1,000 days PH. Maraming salamat, DOH, our mother unit. Thank you.
Maraming salamat, ma'am. May pahabol na question po si Carolyn from CNN. Kung pwede daw.
Hello.
Ma'am, tanong ko lang po sana kung ilang million yung under 5 years old.
Total, all. Yung total universe ng 5 years old or yung stunted in 5 years?
Both, ma'am.
So yung stunted, we have in 2019 survey of the FNRI, ang stunted natin is approximately 3.2 million Filipino children. In 2019 yan. So baka tataas pa yan because of the pandemic. No? So yung wasted naman natin, yung mga butot balat, yung 640,000. So yung underweight naman, yung talagang below sila sa weight nila per age, 2.1. So total of mga 2.1 plus 3.2, mga approximately 6 million Filipino children are affected with malnutrition. And ang overweight and obesity din, ay, meron din tayong 340,000 approximately. So, yun yung data natin, no? So, but we are not again complacent. Everybody is working, government, DOH, our mother agency, and the rest of the members ng National Governing Board, IATF Task Force on Zero Hunger, are working hand in hand really to solve this problem of malnutrition. Because by 2030, we want to eliminate all forms of malnutrition. We will not wait for 2020, 30. So, but we are actually doing our best. I-reverse na lang natin itong COVID-19. I hope we can go back to what we have gained. Thank you.
Ma'am, nabanggit niyo po kasi kanina yung yung sa breastfeeding. May data po ba kung ilang percent yung itinaas and ilan po yun ngayon?
Actually, in 2018, meron tayong 32%. Pero in 2019, nagkaroon na tayo ng 57.9% exclusive breastfeeding. Tumaas siya, no? Almost 100% ang increase. And the latest is in the Rapid Nutrition Assessment Survey among the targeted study group, nag 60.8%. So that means to say that lactating women resorted to breastfeeding their infants, especially during this lockdown. No? So tumaas. Maganda ang effect.
Thank you po.
Thank you.
And thank you, Caroline. Thank you, ma'am. And yun nga, no? So let us all work together to ensure the proper nutrition, proper environment for the first 1,000 days of an infant, no? Investment yun, hindi lang para sa bata, pero sa nation building na rin. We thank our dear Executive Director, Azucena Dayangirang, for joining us today. If you have further questions, feel free to log in sa kanilang website, no, mam1000days.ph. So again, thank you everyone for joining us, and we'll continue to answer your follow-up questions kung meron man. Thank you, ma'am. Thank you po.
Thank you. Bye, everyone.